Gastritis is inflammation of the lining of the stomach. It may occur as a short episode or maybe for a long duration. The most common symptom is upper abdominal pain. Other symptoms include nausea and vomiting, bloating, loss of appetite, and heartburn. Others may have no symptoms. Complications may include bleeding, stomach ulcers, and stomach tumors. Common causes include infection with Helicobacter pylori and NSAIDs. Less common causes include alcohol, smoking, cocaine, severe illness, autoimmune problems, radiation therapy, and Crohn's disease, among others. Endoscopy, a type of X-ray known as an upper gastrointestinal series, blood tests, and stool tests may help with diagnosis. Prevention is by avoiding things that cause the disease. Treatments include medications such as antacids, H2 blockers, or proton pump inhibitors. During an acute attack, drinking viscous lidocaine may help. If gastritis is due to NSAIDs, this may be stopped. If H. pylori is presented, it may be treated with a combination of antibiotics such as amoxicillin and clarithromycin. For those with pernicious anemia, vitamin B12 supplements are recommended either by mouth or by injection. People are usually advised to avoid food that bother them. Gastritis is believed to affect about half of people. As people get older, the disease becomes more common. It, along with a similar condition in the first part of the intestine known as duodenitis, resulted in 60,000 deaths in 2013. H. pylori was first discovered in 1981 by Barry Marshall and Robin Warren. Causes: weaknesses in the mucus-lining barrier that protects your stomach wall allow your digestive juices to damage and inflame your stomach lining. A number of diseases and conditions can increase your risk of gastritis. Gastritis can develop suddenly, acute gastritis, or gradually and last for an extended period, chronic gastritis. Gastritis is associated with various medications, medical and surgical conditions, physical stresses, social habits, chemicals, and infections. For example, aspirin, non-steroidal anti-inflammatory drugs, prescription steroids, potassium supplements, iron tablets, cancer chemotherapy medications. Other causes include stress, alcohol consumption, caffeine, smoking, and others. Helicobacter pylori. Helicobacter pylori colonizes the stomachs of more than half of the world's population, and the infection continues to play a key role in the pathogenesis of a number of gastroduodenal diseases. Colonization of the gastric mucosa with Helicobacter pylori results in the development of chronic gastritis in infected individuals, and in a subset of patients, chronic gastritis progresses to complications. However, over 80% of individuals infected with the bacterium are asymptomatic, and it has been postulated that it may play an important role in the natural stomach ecology. Preventing H. pylori infections. It is not clear how H. pylori spreads, but there is some evidence that it could be transmitted from person to person or through contaminated food and water. You can take steps to protect yourself from infections such as H. pylori by frequently washing your hands with soap and water and by eating foods that have been cooked completely. Complications. Left untreated, gastritis may lead to stomach ulcers and stomach bleeding. Rarely, some forms of chronic gastritis may increase your risk of stomach cancer, especially if you have extensive thinning of the stomach lining and changes in the lining cells. Tell your doctor if your signs and symptoms are improving despite treatments for gastritis. Older adults have an increased risk of gastritis because the stomach lining tends to thin with age and because they are more likely to have H. pylori infection or autoimmune disorders than younger people are. Treatment. Once the diagnosis of gastritis has been confirmed by a medical professional, treatment can begin. The choice of treatment depends to some extent on the cause of gastritis. Some treatments target the exact cause of a particular type of the gastritis. Most treatments aim at reducing stomach acid and symptoms. The patient's stomach often will heal over time if the underlying cause is identified and corrected. Upper gastrointestinal endoscopy. Upper gastrointestinal endoscopy is a procedure that uses an endoscope, a small flexible camera with the light, to see the upper gastrointestinal tract. A healthcare provider performs the test at a hospital or an outpatient center. The healthcare provider carefully fits an endoscope down the esophagus and into the stomach and duodenum. The small camera built into the endoscope transmits a video image to a monitor, allowing close examination of the gastrointestinal lining. A healthcare provider may give a patient a liquid anesthetic to gargle, or may spray anesthetic on the back of the patient's throat before inserting the endoscope. A healthcare provider will place an intravenous needle in a vein in the arm to administer sedation. Sedatives will help the patients stay relaxed and comfortable. The test may show signs of inflammation or erosions in the stomach lining. The healthcare provider can use tiny tools passed through the endoscope to perform biopsies. A biopsy is a procedure that involves taking a piece of tissue for examination with a microscope by a pathologist, a doctor who specializes in examining tissues to diagnose diseases. A healthcare provider may use a biopsy to diagnose gastritis, find the cause of gastritis, and find out if chronic gastritis has progressed to atrophic gastritis. You can find more information about this disease in the following links.